What's going on, everybody? Will Koopal Functional Medicine. So today I want to hop on and talk about women's hormones, perimenopause, and menopause. So what happens in menopause? So basically, the ovaries stop producing hormones, right? We've got estrogen, progesterone, and testosterone. Once those three hormones decrease, you can start having problems with your brain, bone, cardiovascular system, metabolism, and mood. So this hormonal disruption usually starts 10 years before the final menstrual period. Symptoms I commonly see in practice that women come to see me about are hot flashes, anxiety, insomnia, brain fog, weight gain, vaginal dryness, loss of muscle tone, and bone, osteopenia, osteoporosis. So menopause is not just reproductive, it's a whole body endocrine aging process. So BHRT, or Bioidentical Hormone Replacement Therapy, simply means we're replacing those hormones that dropped, right? Once again, those are estradiol, progesterone, and testosterone. So during the perimenopausal transition, the first hormone to drop is progesterone. Progesterone is responsible for sleep and mood. So that's usually the first symptom that women in perimenopause will have. So oftentimes we will do labs. We're going to check with your OBGYN to make sure you're up to date on your mammogram, your colonoscopy, your pap smear, check your family history of cancer risk, and then we're going to focus on the lifestyle changes, right? Getting you eating better, stress reduction, sleep better, and oftentimes giving some progesterone can help with that sleep. My women that are in menopause have already gone through perimenopause. Oftentimes I'll replace all three of the hormones. Usually I put estradiol and testosterone in a cream, and then they'll take oral progesterone at bedtime. But like I said, obviously we're going to check your mammogram, your pap smear, your colon, make sure you're clear to go. We're not just going to willy-nilly throw you on these hormones. We're going to do some lab testing to make sure your levels are actually declined. And then as we go with these hormones, we're going to be checking levels as we go to make sure you're at a therapeutic dose. A lot of times I also like to check stool tests, which looks at the microbiome to make sure you're detoxing these hormones correctly. Another thing I wanted to talk about was the big myth that hormones cause cancer. So there was a 2002 study that scared millions of women away from getting on hormone replacement therapy. But that interpretation was very flawed. So risk depends heavily on age and timing of therapy. Starting therapy before the age of 60 or within 10 years of menopause is generally considered safe for healthy women. So updated data also suggests if you replace these hormones, women have a lower all-cause mortality rate, reduced fractures, and cardiovascular protection. So a recent study that I was reading shows up to a 50% reduction in heart disease with hormone replacement therapy, if done correctly, a 35% lower Alzheimer's risk, and a 50 to 60% reduction in fractures when started early. So once again, the timing matters. The window of opportunity is usually, like I said, during that perimenopause, early menopause stage. And that's when we usually see symptom relief, cardiovascular protection, bone preservation, and cognitive support. So generally, if it started 10 years after menopause, that can pose some risks. So that population is a little more nuanced. So if that is you, we'll work closely with your OBGYN to make sure these hormones are done safely, right? So if you like what you heard, give me a like, give me a thumbs up, shoot me a message if you have any questions. I'd love to get to know you and get you feeling better.